We are back here on the River City Hardball Podcast. I'm your host, Andrew Gibson, and it's been too long since we've talked to our friend Jacob Evanich from Optimize Physical Therapy and Sports Performance. First of all, you got married. You just came back from Hawaii. Congratulations. How has the last week or so been for you?
Dude, it's been so nice. Wedding was great. It feels weird being a married man saying that, but it's awesome. Wedding went great. Honeymoon was amazing. It was awesome getting away, but man, I feel like I really have been away for a long time. So it feels like it's been forever since we did this podcast, and I'm excited to get after it again.
That's great. Tell me about Hawaii. Which part did you go to? What was the experience like?
Yeah, so we ended up staying on Kona, the Big Island, and we just stayed there the whole time because we were only there about 6 days. I heard you need a little bit more time to kind of island hop. But it was cool. I would definitely suggest it for anybody, especially people who like some of the more like physical, like hiking and snorkeling and all that kind of thing. Some amazing snorkeling. Got to see the manta rays out there in the water, which they say is like a top 10 thing you need to do before you die now, because it is really cool. And yeah, so it was great. And then of course you have the Hawaii just kind of leisure and resort life too. So it's a good mix of everything. So everybody should definitely do it once in their life.
That's awesome. I know you had a blast there, and welcome back. Congratulations once again. So tonight we're going to focus on lat strains. This is obviously something that you see a lot in baseball with, it can be position players, but I would feel like pitchers probably get lat strains a bunch. Tell us about lat strains tonight.
Yeah, so it is. It seems like it is a little bit more common in pitchers. I know Syndergaard is the main name that stands out to me. I know he ended up having a little bit of he had a Tommy John surgery this last year, but before that, it was the lat strain that was keeping him out and kind of nagging him. Most recently, we were talking before we got on the podcast, the most recent is Dak Prescott. He had the lat strain that's kind of keeping him out of the preseason games for the Cowboys and everything. So it definitely happens to the overhead throwing athletes. And yeah, it can linger and it can take a while to rehabilitate. But the lat, so they end up calling it like the Lat Teres Complex is what it is, because there's a teres major muscle is what it's called, along with the lat, and we all know what the lats are. When I was thinking about this podcast, I just remember me and my buddies when we were younger and lifting and everything, we'd always call them our wings. And when we were lifting, doing some lat pull downs, we just puff out our arms and be like, "Hey man, check out my wings." And that's what the lat is. It's that part behind the armpit that kind of sticks out. So the lat actually goes all the way down to the hip. It attaches to part of the back, some of the ribs, and it attaches to the front of your shoulder. And then the teres major muscle starts at the bottom of your shoulder, the bottom side of your shoulder blade, and it attaches to the front of your shoulder also, either in the same place as the lat. Sometimes the teres major ends up attaching actually to the lat tendon, and then the lat tendon is only what inserts onto the humerus bone, the shoulder bone. And sometimes they're just really close and they're both attached in a similar spot. But so people end up just calling it the Lat Teres Complex because they really do work together.
So how does a lat strain happen? Is that just with fatigue, with throwing? How does that happen?
Definitely fatigue is probably definitely a part of it. It's actually not super common, so there's not a lot of literature on it at this point, not a lot of studies. So there's not, when we went over the UCL and injuries like that, it happens so often. So we had this, I think I went over like 10 or 12 risk factors when we were talking about the UCL injuries. With this, there's no specific risk factor like list they end up saying, like recommending to look out for, but definitely anything with muscles and tendons, any kind of chronic workload where the tendon starts breaking down and it's a little bit more than the muscle and tendon can handle. Then you start getting maybe like a tendonitis or something that can break down the tendon, or also, yeah, just the muscle strain because the muscle really gets overworked. And those muscles, they end up extending the arm backward. They bring the arm across the body, and they also help with internal rotation of the shoulder. So all those are really important with throwing, especially pitching. So in the pitching sequence, the way it ends up working is when we get into the late cocking, which we think the very like top position, when we're swinging that arm back, that lat teres complex ends up working to help slow down the arm getting back there, because if you don't have any control, then the arm's just going to fling back, and it ends up actually really hurting the front of the shoulder, the anterior capsule is what we call it. And so those muscles help kind of, once we're getting up there, they help slow that down to get us ready to come forward into the acceleration phase of throwing. And then those muscles, they do bring us through the acceleration phase. They help with that internal rotation of the throwing motion. And then they also are really big with what we call like the deceleration phase, when we're letting go of the ball and the arm needs to slow down. The Lat Teres Complex is really big with that.
So I'm going to give you something that I think I've learned in our podcast. Does this also include the external rotation that we've mentioned before?
It does, in the fact that, and I love when you do that. I love when you do that to show that maybe this is rubbing off on some people. But it involves the external rotation just because the fact that these muscles are more the internal rotators. So we call it like, if the muscle's elongating and helping slow a motion, so when we're talking about going into that cocking phase, which is the external rotation, the internal rotations help to slow down that movement. So those muscles are working, but they're actually getting longer as they're working. And then they really work when we talk about like a concentric movement also, where the muscles are like shortening together to help cause the movement. But the eccentric portion of it, where the muscle is elongating but working to slow down the joint into external rotation, that's when it really works the most, and that's probably when a lot of these strains end up happening. So it does involve the external rotation, but just because that motion is the opposite. That muscle does the opposite motion of the external rotation.
So I know we talked mostly about pitchers and these injuries, but you mentioned something earlier, Dak Prescott of the Dallas Cowboys, who the Jaguars face on Sunday. He's not going to play. But is that common?
Like their whole team's not going to play pretty much.
Yeah, it's like the third preseason game, which used to be the fourth. So I don't know. A lot of guys probably not playing, but we'll see about the Jaguars. But does that happen with quarterbacks routinely? I wonder how that works.
I can't remember one ever happening, unless they used to keep it a little bit more hush than what they do now. With they're better now saying specifically what the injury is. I remember back when I was growing up, they just said, an arm injury or something, or they're really vague with it. So I'd never really heard of that happening, especially with football. It's more like always collarbone or some kind of like labrum issue or something like that from getting hit.
Right.
So yeah, I don't know how he ended up doing that, but like we were talking about, you have to. It's the football's a little bit heavier, so it doesn't have the same forces that go through the arm. It's not as violent as like the pitching motion. So that's why you don't see quarterbacks usually hurt their arms. Sometimes it happens, but usually not. There's just not as much torque having to go through the entire arm, but it happens. I mean, Ben Roethlisberger had a UCL surgery. He had the Tommy John surgery, and yeah, Dak got this. So it does happen from time to time.
So when we talk about strains, a lot of times we discuss like grades of strains. Mm-hmm. Is that the case with the lat strain? Do you have different grades of it?
Yeah, absolutely. So that's actually one of the biggest things with knowing how you need to go about the rehabilitation process. So we need to know if we're thinking it's a lat strain, and lat strains are kind of hard to diagnose too, because it's not what we call like a non-specific pain. It can be just like general pain throughout the shoulder, and sometimes because it attaches to the front of the shoulder, you can have pain in the front of the shoulder also, which mimics a lot of the typical shoulder pains that we end up seeing. Most people end up getting a pain in the front of their shoulder first when they're having some kind of shoulder issue, but that's usually because of like the bicep tendon or some kind of tendonitis in that area. We're not usually thinking the lat. So it can be hard to diagnose. It's easier if the muscle strains enough where you do see some kind of like bruising, which will end up being more on the back of the shoulder. So that makes it a little bit easier. Also, if you're throwing and you end up having some pain or decreased velocity in that area of the back of the shoulder, that's when you're kind of thinking a little bit more of the lat strain and everything to diagnose it. But with the imaging is actually really important with this one. A lot of times with injuries, we say, no, we can actually kind of figure out what's going on without the imaging. This one, if we're thinking there's some kind of strain, we want to know how big the strain is, and especially if what we call like an avulsion fracture can happen, which is when the tendon actually rips the bone off where it inserts onto the shoulder. And if that happens, or if there is a full tear of the actual muscle, then we need to repair that immediately with the having surgery. because that muscle and that tendon can kind of shrink down and shorten. And then it's really hard for them eventually to have to pull that back up and get it back into place. But if it's more just a strain to a certain degree where there's not significant muscle tearing, then we know, okay, let's go the non-operative route and see if we can rehab it that way. And that's the most common way to go about it. They usually always try some kind of non-operative route with having physical therapy. And they give up to about 3 months to do so, 3 to 6 months. And then if a guy's still having pain or he comes back and he's just not to the level that he was at before, then they might try the surgery at that point. But they always try at least for about 3 months to go with the rehabilitation.
So what does a rehab technique process look like for a lat strain?
Yeah, so a lat strain, usually the range of motion, when you have a lat strain, the range of motion isn't really affected. You're just having more of the pain and you can't really use the muscle in the way you could before. So like we were saying, like the decreased velocity and things like that. So first of all, you need to decrease the pain always. So while we're trying to decrease the pain through different modalities, whether it's a little bit of massage or there's different techniques out there, like even laser can help it, things like that. So you do that to try to calm down the pain. While you're doing that, work core, work lower body, work everything you can other than the arm. Once you're not having the pain anymore, that's when it's time to really push the strengthening a little bit more as much as we can. And then we get a little bit more dynamic over time. So we do basic strengthening, hitting certain muscles in the shoulder. Then we start doing more like plyometrics. We're thinking like even like med ball tosses, things like that, that mimic the sport a little bit more. And then after strength is really good, range of motion is for sure full, no pain, then that's when guys will kind of start a throwing program. With some of the guys that they've tracked in some of the studies with pitchers, so about 35 days out, about 1 month, guys will start throwing again, typically on average. 2 months out, 62 days was pitching to start getting on the mound and working that. But then to actually get back to the full gameplay and rehab starts, we're looking at more like 82 days is what they ended up finding. So about that 3 month mark to really get all the way back.
I remember when, as you mentioned earlier, Noah Syndergaard, one of the more famous lat strain injuries, they said this was back in 2017. He had a partial tear of his right lat. Boy, that sounds painful.
Yeah. So he had the partial tear. So they probably ended up, I didn't look too much into it, but I don't remember them ever saying he had like surgery or anything. So it had to have been the non-operative route that they ended up going with that one. But yeah, it's such a big muscle and it helps with that force going from the ground all the way up to your shoulder. It's huge with that since it attaches all the way down to the hip. So yeah, every time you throw, I can't imagine it feels very good. When you do have surgery too with the rehab process, it does take significantly longer to get back. So about 6 weeks, you're in a sling. They don't even want you moving it because it is a pretty significant surgery. After the 6 weeks, then during those 6 weeks, you go to physical therapy so the physical therapist can start stretching your shoulder a little bit. You might do some elbow and wrist exercises to keep motion and strength in that. But the first 6 weeks, you're not really doing anything. After that, then you get a little bit more aggressive with the stretching. You want full range of motion by like 6 to 8 weeks at the latest. And then you start with that strengthening process like we were talking about before. And somewhere between 3 to 4 months is when they're hoping to get the guys to start just lightly throwing. And at the earliest, you're thinking like 6 months, more between like 9 to 12 months to really return to actual throwing and pitching in games. So it is a pretty significant rehab process.
So I was reading a little bit about Syndergaard, and I don't remember this, but he actually refused to take an MRI. And his quote was, yeah, when this happened, he refused to take an MRI. The quote was, Syndergaard said, "I think I know my body best. I'm pretty well in tune with my body, and that's exactly why I refused to take the MRI." Wow.
Oh, that's interesting. I wonder it's crazy with the arbitration processes and everything with the contracts for MLB guys. People don't really realize it, but I mean, when they come together for a contract, they're looking at everything from the past medical history, and they're really, they'll knock off a certain dollar amount based off of a certain thing that's found in imaging and everything. So I guarantee you that's why he kind of refused that from the Mets. I guarantee it.
Well, and he was 24 at the time, and you think that, you're invincible when you're 24 years old. So you're just going to try to pitch through it. And there's just some things you can't do. You can't pitch through, right?
100%. Yeah. And I wonder, I mean, it's all, we don't have all the information here. You can't say anything for sure, but it's just interesting when you have injuries like that, how much does that affect the pitching motion? I know you're still throwing really hard. So it's hard to say. Does that end up being part of what ends up leading to the UCL, or the UCL happened anyways? You could have had perfect form, perfect strength, and the UCL just happens anyways. But it's just always interesting to think about with that stuff.
Great conversation as always. So now that you're back from the wedding in Hawaii, are you covered up with stuff to do? Do you have a lot going on over there at DBAT?
Oh my gosh, man. Yeah, it was an eye opener and a shock to get back there and get back into the routine. But I love it there, man. It's so much fun working with softball and baseball players. And by the time, I mean, this is Thursday we're doing this, so I'm back into the full swing of things and just excited to get after it. It's so much fun to get these kids just really performing at their best.
I love to hear that, man. That's great stuff. We always appreciate the work that you do with Optimized Physical Therapy and Sports Performance. Check them out over there at DBAT. If you guys haven't been to DBAT, you're a baseball or softball player in the area, you got to check them out. I was actually over there. I was over there recently. One of the travel teams around Jacksonville had a day where they couldn't go out there and play. They couldn't try out because it was just pouring rain out here. And Zach at DBAT said, "Come on over. We got space for you." And all the guys that were trying out got to go indoors with the fantastic facility at DBAT. And they got to do everything that they had to do for the tryout. And Zach and the guys couldn't have been better. It was awesome. It was a Saturday. The place was pretty busy, and they offered an opportunity for those guys to go in there and get their work done. So if you guys are looking for a place, definitely check out DBAT. And I definitely want to get back over there and see you and Zach pretty soon. I hear that we've got a fantasy football draft coming up over there soon. So I gotta be over there for that.
Yeah, now that you're going to be part of it, Gibby, I'm really going to do my scouting. I'm going to do my best to not fall behind you in the league.
I can't wait. I love that stuff, man. Well, hey, great stuff as always. Appreciate your time. For those that don't know, tell us about your website. Tell us where they can find you.
Yeah, so you can find me at optimizedptsport.com. Can find us on Instagram at Optimized Physical Therapy and Sports Performance, and the same on Facebook. You can also find us there. There's areas there where you can get in contact with us if you are interested in some of the sports performance, or if you are having some if you're having some pain or hurt something to get some physical therapy treatment. You can contact us through those means.
Jacob, you're a married man. Congratulations, and we'll do it again next week. Thanks, man.
Did I seem different on this podcast?
I think you're still the same guy, but
right.
that might change over the years. We'll see.
I had to make sure.
Hey, right. I'm about to go through the same process, so we'll find out if I'm the same guy or not. We'll see.
I'll talk you through it.
All right, man. Have a good night. We'll see you next week.
All right. Thanks, Gibby.